Hello everyone, I'm Anas Al-Ubaidi, and the topic or the title for this session or lecture is Final Assessment, Gastroenterology and Nephrology Scribe Certification Exam from Chapter 30, which is about review of gastroenterology and nephrology scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The final assessment for the gastroenterology and nephrology scribe certification exam is a critical step in the process of becoming a proficient medical scribe specializing in two of the most complex areas of medicine. This certification measures your ability to apply advanced knowledge in documenting patient evaluations, diagnostic procedures, and treatments for both gastrointestinal, GI, and renal conditions. Earning this certification signifies that you have mastered the skills necessary to support healthcare providers in these specialties, ensuring that medical records are accurate, detailed, and comprehensive. This exam evaluates not only your technical understanding of gastroenterology and nephrology, but also your ability to translate clinical findings into well-structured documentation, from detailing a patient's abdominal pain to accurately interpreting renal function test results. Proficiency in this role requires a clear understanding of medical terminology, symptom assessment, and the nuances of diagnostic procedures. The exam also emphasizes the importance of recognizing red flags and documentation, critical pieces of information that may require immediate medical intervention. For example, a scribe specializing in gastroenterology must identify and document concerning symptoms such as hematemesis, vomiting blood, or severe dehydration due to diarrhea. Those in nephrology must be able to note key changes such as a rapid decline in GFR glomerular filtration rate or signs of electrolyte imbalance. By focusing on these details, certified scribes become indispensable in supporting timely and accurate clinical decision making. Key points. Gastroenterology documentation essentials. Symptom documentation for gastrointestinal conditions. Students must ensure a robust understanding of how to assess and document GI symptoms comprehensively. These include detailing the onset, location, duration, characteristics, and modifying factors. For example, abdominal pain accurate documentation includes recording specific descriptors such as sharp localized pain in the epigastric region worsened with meals. Diarrhea include frequency, consistency, and associated symptoms like cramping or fever. A case of diarrhea in a young adult with blood present could indicate inflammatory bowel disease (IBD). Nausea and vomiting specify the triggers, relationship to meals, and if accompanied by weight loss. GI cases involving recurrent vomiting may suggest an obstruction or gastroparesis. And here is a diagram summarizing the gastrointestinal symptoms. Understanding gastroenterology diagnostics, a certified scribe must know common diagnostic tools, their purposes, and findings. Endoscopy and colonoscopy used to visually inspect the mucosa of the gastrointestinal GI tract, document preparation details, for example, fasting, bowel preparation quality, and findings such as ulcerations in the duodenum or polyps in the sigmoid colon. Imaging tests, CT scans of the abdomen provide detailed views of structures, while abdominal X-rays assist in identifying obstructions. Scribes document findings concisely yet thoroughly, including follow-up plans if imaging shows, for example, dilated bowel loops consistent with obstruction. Common GI conditions, gastrointestinal conditions, and documentation protocols. The exam will likely test how you document GI conditions based on clinical scenarios. Familiar examples include GERD, gastroesophageal reflux disease, symptoms commonly described as burning pain in the chest, worse after meals or when lying down. Document any treatments like proton pump inhibitors, PPIs prescribed during follow-up. Crohn's disease CD document patient-reported symptoms such as prolonged diarrhea and weight loss. Include any findings from imaging or colonoscopy such as segmental inflammation in the ileum. Flagging red flags in GI gastrointestinal cases, recognizing and documenting red flags such as persistent vomiting, unexplained weight loss, or blood in the stool is critical. For example, a patient with acute onset severe abdominal pain and guarding raises suspicion for perforation or ischemia, conditions requiring urgent attention. And here's a diagram showing the lack of recognition leads to severe, as the lack of recognition leads to severe complications. Nephrology documentation essentials, renal function and key clinical markers. Scribes must excel in documenting renal function tests and their interpretation. The most important values are serum creatinine elevations indicate declining kidney filtration ability. Document findings such as creatinine elevated to 2.1 mg per dl from baseline of 1.3 mg per dl, suggesting acute kidney injury. AKI. GFR glomerular filtration rate, a hallmark of kidney function. A GFR of less than 60 ml per minute represents chronic kidney disease. CKD link integrated findings such as GFR trends alongside creatinine. Electrolyte levels, sodium, potassium, and calcium abnormalities can signal kidney dysfunction. Document critical levels like hyperkalemia at 6.5 millimole per liter, alongside symptoms such as muscle weakness. And here's a diagram showing the visualizing key renal function markers. As here, renal function documentation, we have severe serum creatinine levels, GFR trends, and electrolyte abnormalities. Chronic kidney disease, CKD management. Chronic kidney disease, CKD, is vital for certification exam. Documentation tips include symptoms and highlight changes in urination, for example, frothy urine for proteinuria or swelling edema due to fluid retention. Risk factors, diabetes and hypertension are leading causes of CKD. Include these details in patient history. Medications, scribes must note medication adjustments such as reducing doses of drugs cleared renally, highlight nephrotoxic drugs to avoid errors. Acute kidney injury, AKI documentation. AKI cases test your ability to document rapidly changing clinical conditions. For example, etiology, document prerenal causes like dehydration, BAN slash creatinine ratio more than 20, or intrinsic causes like nephrotoxic drug exposure. Daily progress. Scribes must accurately record urine output and lab changes during treatment, such as increasing diuresis with IV fluids. Procedures and interventions. Nephrology scribes document procedures like hemodialysis. Details include the type of dialysis access, for example, IV fistula or central catheter. Record vital statistics post-dialysis, including weight changes or hypotension episodes. Complications to report. Red flags and renal causes include hyperkalemia symptoms, EKG or ECG changes, metabolic acidosis, or signs of uremia, confusion, pericarditis. As for hyperkalemia, high potassium levels, meaning shows EKG changes, or there are ECG or EKG findings that is called peaked T wave or tall T wave in the ECG. Properly integrating these into documentation ensures timely clinical action. Bridging gastroenterology and nephrology, students must understand the interconnectedness of these fields. GI conditions impact kidneys. Severe vomiting or diarrhea may cause dehydration, leading to pre-renal acute kidney injury, AKI. Scribes should link symptoms to lab findings such as elevated BAN/creatinine, which is blood urine nitrogen for BAN/BUN. Renal conditions, GI manifestations. Advanced CKD, chronic kidney disease, can cause symptoms such as nausea and anorexia due to uremia. Include this systemic link in documentation. Summary tables. Here we have table on key gastrointestinal GI symptoms and their documentation. Table on common gastroenterology diagnostic tools. Table on common renal function tests and their significance. Table on red flags in gastroenterology cases. Table on red flags in nephrology cases. And then next, We will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. Which of the following is the most important detail to document when a patient reports abdominal pain? A. The patient's occupation. B. The location, onset, intensity of the pain. C. The family history of diabetes. Or D. The last time the patient exercised. Definitely would be B. The location, onset, intensity of the pain, the abdominal pain. As to properly assess abdominal pain, medical scribes must document specifics such as location, onset, and intensity. These details help providers determine the possible cause, whether it's gastritis, appendicitis, or another condition. The other options are less directly relevant to the immediate evaluation of abdominal pain. Question 2. Which diagnostic test is commonly used to confirm gastroesophageal reflux disease GERD? A. CT scan, B. Endoscopy, C. Stool analysis, or D. Colonoscopy. B would be the answer B, endoscopy. As endoscopy is a key diagnostic test for GERD, gastroesophageal reflux disease, as it allows direct visualization of the esophagus for signs of inflammation or erosions caused by acid reflux. A CT scan is better suited for structural abnormalities, and stool analysis or colonoscopy assesses the lower GI gastrointestinal tract. Question 3. What does a rapid decline in glomerular filtration rate, GFR, indicate? Chronic kidney disease progression, A. B. Acute kidney injury, C. Uncontrolled hypertension, or D. Urinary tract infection. So, rapid decline in GFR. Decline in GFR could be A or B, but rapid decline in GFR indicates acute condition, as an acute kidney injury, AKI. As a rapid decline in GFR typically indicates acute kidney injury, signifying sudden loss of kidney function. Chronic kidney disease, on the other hand, involves a gradual decline in GFR over time, whereas uncontrolled hypertension and UTIs are different clinical presentations. Question 4. Which of the following symptoms is a red flag that requires immediate documentation and action? A. Occasional bloating after meals. B. Black tarry stools. C. Mild nausea lasting a day. Or D. Side difficulty sleeping. As we remember, within this session or the slides of this lecture, we reflected and explained immediate documentation and action or immediate attention would be, for instance, unintentional weight loss, persistent vomiting, and the black tarry stools. And so the black tarry stools here, which is B. As black tarry stools or melena indicate upper GI gastrointestinal bleeding and require urgent attention. This could signify a bleeding ulcer or malignancy. The other symptoms, while important, are not as immediately concerning. Question 5. Why is it crucial to document the presence of hyperkalemia, high potassium levels in a patient with renal impairment? A. It can predict calcium deficiency. B. It increases the risk of cardiac arrhythmias. C. It helps measure hydration status. Or D. It signals chronic bladder issues. If we remember, we talk about the high potassium levels, hyperkalemia, as could be seen through ECG or EKG findings, and we said something called toll or peaked T-wave. And since there will be ECG finding or EKG finding, which means heart. And the only choice here that is as a complication related to heart is B, as it increases the risk of cardiac arrhythmias. So hyperkalemia, high potassium levels, or high potassium levels can lead to life-threatening cardiac arrhythmias if untreated, if left without management. Proper documentation ensures that providers can act quickly. Other options are unrelated to the immediate severity of hyperkalemia or high potassium levels. And here we come to the end of this lecture. Thank you very much and goodbye.